Hi everyone, it's Gav Solomon here, and for today I'm going to be filming to make a neurological system assessment, as well as a motor assessment with my friend here, Dave. So Dave, are you okay with me palpating you, closely observing you, and putting you on record?
Yeah, sure.
Okay, so prior to assessment, we're going to ensure we have proper lighting, which there is. We're going to ensure patient privacy by either closing the door or the blinds, and performing hand hygiene in between. So before we start, I'm going to ask you mental health questions regarding your history. Have you had any major head injuries?
No.
Okay. Have you had any major seizures?
No.
Okay. How about tremors?
No.
Extreme weaknesses?
No.
Extreme difficulty speaking?
No.
Difficulty swallowing?
No.
Okay. Dave, can you tell us your full name and date of birth as well?
Ralph David, June 17, 2000.
And where are we now?
We're at your place right now.
Okay. And what month are we in?
We're in the month of July.
So based on initial observation, his appearance is well groomed. He's also clean and shaven. He's also dressed appropriately for the setting and the weather. In terms of his behavior, there is no involuntary movement. Everything is coordinated and purposeful. In terms of his cognition, he is alert, awake, oriented to time, person, and place. And in terms of his thought process and speech, it's clear, understandable, and moderately paced. We're going to move on to assessing the 12 cranial nerves. The first one being the olfactory nerve. Number 1, I'm going to have you close both your eyes, then include one of your nostrils, and then I'm going to present 2 familiar odors, okay?
Yep.
Here we go.
Soap.
The other one, please.
Mouthwash.
Perfect. So as you can see, David is able to identify both familiar odors. And did you have any pain or any sensation while smelling?
No.
Okay. His sense of smell is within defined limits. We're going to move on to the optic nerve. So I have this pen light, which I'm going to use. It's going to be used to test his visual acuity. And we're going to do the diagnostics positions test. So Dave, can I have you look at this pen light for me? Okay. And then we're going to go top right, right, bottom right, good, top left, left, bottom left. So while assessing, I can see that David's eyes has great eye coordination. There were no signs of any oscillating movement bilaterally with his eyes, and also no presence of nystagmus. His visual acuity is within normal limits. Now I'm going to do the number 3, which is ocular motor. Number 4 is the trochlear nerve, and number 6 is the abducens nerve. I'm going to be performing the Hirschberg corneal light reflex. So, Dave, can I have you look just past my shoulders? And then I'm going to pass this pen light right on the side of you, okay? I'm going to also put it towards the center. Okay, good. Okay, so while assessing, I can see bilateral reflections that are centered. The eye was not deviating or not drooping elsewhere. His eyeball positioning was within defined limits. The next thing I'm going to do is assess the 5th trigeminal nerve. And I'm going to have David just clench both your teeth for me. Good. I've sanitized, and I'm going to feel for his temporal muscle. Clench again for me. And then his masseter muscle. Good. Did you have any pain while doing that?
No.
while assessing both his cheeks, size of the cheeks, there was like equal movement, equal strength, and that part of the nerve assessment is within defined limits. Now we're going to go to cranial nerve number 7, which is facial. I'm going to ask David to raise his eyebrows for me. Okay. Just smile for me. Good. And puff up your cheeks for me. I'm going to just try to poke you. Good. So I could see that there is bilateral and equal movement in all the muscles that were performing the action. As I attempted to poke his cheek, no air escaped, so he has good control of those muscles, and that is within defined limits. Next is going to be acoustic, which is 8. I'm going to be standing behind the patient. The patient will occlude one of their ears, and I'm going to do the 4-word whisper test. Just try to repeat what I whisper to you, okay? Okay.
Apple, orange, banana, watermelon.
Okay, the other ear.
Chair, furniture, bathroom, bed.
Okay. So David was able to identify all the whispered words, and his hearing is within normal limits. Okay, the next one we're going to test is the 9th, glossopharyngeal, followed by the vagus, which is number 10. And I'm going to use a sterile tongue depressor. And I'm going to be depressing it against his tongue and observing within his mouth. Okay. After observing his mouth, I can see that the uvula is midlined, and also his tonsils are appropriate where they're at. They're not too close to each other, which would indicate difficulty in swallowing. The next one I'm going to be testing is the spinal accessories. In particular, we're going to be testing the trapezius muscles and the sternomastoid muscle. So Dave, can I have you shrug your shoulders up and down? Okay, good. One more time. Good. I'm going to be applying resistance now. Okay, good. And then I'm also going to be touching your face. Just turn left and right for me, okay? Turn. Good. Turn. So while performing the assessment, I can feel bilaterally that his muscles are of equal strength and they're both performing at symmetrical movements. Number 12 is the hypoglossal nerve, and I will be asking David to protrude or extend his tongue out. Okay, can you phonate ah for me? Good. Can you wiggle it left to right for me? Good. So as I could see that the tongue is midlined, and there is no excessive drooping or draping of the tongue, which would indicate an abnormality, and there was no slurring while saying or phonating the word ah. Next, we're going to do the motor system assessment, and right off the bat, we're going to be focusing on the upper and lower extremities. As I can tell, just while assessing, that the size is both equal bilaterally, and I can see that the tone is symmetrical. I'm going to be asking David to just put your arms up like this, push against my hand. Okay, good. Pull against it. Good. Can you abduct your arms like this, and then adduct? Good. With your feet, just push against my hands. Okay, pull against it. Good. In terms of his strength, bilaterally, they are both equal and symmetrical with the movement. There is no involuntary movement, and he has full range of motion, which is in defined limits. We're now going to be assessing his gait and his balance. So Dave, can I have you stand up for me, please? And to observe the gait, we're going to be having him walk 3 to 6 meters, okay? So yeah, just walk for me. That's great. Okay, back over here. So as you can see, Dave has normal gait and great balance. He's also going to now perform tandem walking. So we're just right over here, side by side. It's perfect. Okay. Nothing is off balance, everything is in check. And we're going to do the last one, it's called the Romberg test. I'm going to have him just right in front of here. Here's fine. Yeah. I'm going to place my hands at his side. Can you close your eyes for me?
Mm-hmm.
We would do this for about 20 seconds. And as of the moment, Dave has negative Romberg. He has good balance and good gait. Okay. We're going to continue to sit down now. So the next thing we're going to do is the rapid alternating movement. So with this one, I'm going to see with your hands pronating and supinating as such, and do it as fast as possible, okay? Good. So Dave was able to perform the action without any faults, and both of his hands were symmetrically in line, and there was no disturbances. Can we do the finger-to-finger thumb test, please? Okay, good. All of the fingers touched were intact. There was no fingers that were uneven, and that's within normal limits. The next thing we're going to do is the finger-to-nose test. So can you touch your nose with one of your fingers? Now one of mine's, one of yours, one of mine, one of yours, one of mine. Last one of yours, one of mine. Good. This performance demonstrates good eye coordination and no hesitancy to go elsewhere with the finger movement. Next, we're going to be performing the heel to shin test. Optimally, we would want the patient in a supine position, but for this demonstration, we're just going to do it while sitting down. So, Dave, can I have you rub your heel against your shin? Okay, good. Good. And Dave was able to perform this action very smoothly and concisely. If there was an abnormality, it would indicate a cerebellar disease, but as such, everything is within defined limits. So thank you for this, okay? And yeah, that concludes our assessment. I hope you guys enjoyed, and everything that's been noted will be documented, okay? Anyways, bye for now. Okay.